I love being here in Kenya. It's a beautiful country and the people are really so friendly and nice. The funding of the Veterinary Population Management Laboratory comes from the University of Pretoria, the HSUS initially, and later on the HSI. And they've provided this support since 2003. And basically, it's to assist in personnel for vaccine production. Then we also had a big grant from Technology Innovation Agency, South Africa, and that was to investigate new forms of pZP vaccine. That has been completed, and we do in fact have a new vaccine which works in donkeys and horses, but we hope to test that soon in elephants. Martin will tell you more about that. So this is the list of the team and collaborators, which come from various parts of our faculty at Onderstepoort, the HSI, CSIR, Utrecht University, and then of course the many veterinarians who are responsible for the treatment of elephants in various game reserves, and in fact there are 34 of them currently. Right. Talk about elephant immunocontraception. There are two immunocontraception methods that are used. The first is the zonapalooza vaccine, or pZP. It's prepared from the ovaries of slaughtered pigs, and the final product is then formulated with Freund's modified complete for the primary and Freund's incomplete adjuvants for the booster vaccinations. In 2003, we started to produce the vaccine in our laboratory and have produced it ever since, and we fulfill the requirements for the whole of South Africa, and we hope soon for other countries, especially India, in the future, and possibly even some elephants in Kenya. Let's hope so. Then there's the GnRH vaccine. Improvac is the one we've been using. We've used this in bulls to control androgen-related aggression in these bulls, but it also works in cows. And in cows, we use it mainly or exclusively in captive cows because it also stops them from cycling, which in captive elephants, where you've got mixed sexes, is a great advantage. So how does this pZP work? Basically, when an elephant comes on heat, like other domestic animals, it produces estradiol, which affects behavior. It produces pheromones, which attract elephant bulls. It then ovulates. If it's mated, then the sperm will land up in the fallopian tube, where they will encounter the egg with the zonapalooza capsule around that. Once binding has taken place, the sperm can enter the oocyte and fertilize it. So how does this work? How does the pZP vaccine work? We can, and this is important, we can apply it remotely, all right, deliver it remotely, so you don't need to capture an elephant in order to carry out this vaccination. So it's done usually from a helicopter. The animal produces antibodies to those zonapalooza proteins in the vaccine. These proteins, when these antibodies, rather, when the animal ovulates, will bind all the way around this capsule, and amongst others block sperm receptor sites. So Mr. Sperm comes along, or Mrs. Sperm comes along, and cannot actually bind to these receptor sites, and therefore can't fertilize. So there's no fertilization, no pregnancy. Estrus cycle continues to take place every 15 weeks roughly in elephants. But of course we do have seasonal anestrus, which is common during, depending on rainfall and nutrition availability. Okay. The need for a primary and then booster vaccinations is explained in this diagram here. With the primary vaccination, you get a response, but a much lower response than if you carry out boosters, where you get an increased response each time, and then with the annual booster, you get an increased response, and slowly the antibody titers will wane. So when you reach a stage which is undefinable, it varies from animal to animal, the cow might conceive again. So we refer to that as reversal if you stop vaccinating. Okay, the beginnings of elephant immunocontraception. The study was based on the work carried out in horses by Lou Kirkpatrick, Turner and others. In 1995, I was contacted by J. Kirkpatrick, the big guru of immunocontraception in horses, and Richard Farrer-Hoskin. Sadly, both of them have passed away in the meantime. And the idea was to provide proof of concept in elephants, mainly with in vitro studies, and then follow up with a field trial in the Kruger National Park. And this took place from 1995 to 1999. And the result was that we provided proof in each study that this vaccine was likely to work. From there, in 2000, the project moved on to Makalali, which is now the flagship immunocontraception project. We tested the efficacy, safety, reversibility, and population effects, and Audrey is going to address that part of this morning's deliberations. Okay, so in 2002 to 2005, we had another six reserves that joined the immunocontraception project. These are just the, so this is just some of the data of these various reserves. Here you see reserve size in hectares, population size, and age of cows, and then importantly, the estimated mean calving percentage before treatment per year, okay? Some of these places didn't have any data. But basically it turned out to be a calf every 3.5 to 4 years, thereabouts. Okay, so we had these 7 reserves, a total population across all the reserves of 108 cows that were treated. These cows were normalized in this diagram here according to the number of years they were in the program. So most of them were 7 years in the program, some only 6. Hence a reduction in the number. Okay, so what did we see? We saw, first of all, very important, is that there were calves born during the first 2 years. And this was the result of cows already being pregnant prior to the first vaccination. Once we arrived in year 3 and those cows had calved, we had 0 cows calving. So a tremendous 100% efficacy result. Now I must add that these animals, these cows, were all individually identified, so you could make sure that you actually immunize each animal. Okay, this would not be the case if you do blanket treatment. So safety during pregnancy was shown. 57 of those cows were pregnant at various stages during the first 2 years of vaccination. They gave birth to normal, healthy calves, thus demonstrating safety. Two calves were lost after birth due to injuries, i.e. they were not related to contraception. The contraceptive effect reached was reached around about the time of the first booster. So if we just look at this diagram, it shows you the distribution of pregnancies across those 57 cows. So they were equally distributed through the first, second, and third trimesters. And if we look at conception in relation to the primary vaccination, 55 of the cows had conceived already before. This was extrapolating back from the calving date. One around the time of the primary, and one around the time of the first booster. Nothing after that. So, after that, additional game reserves were added to the program. 18 private game reserves and 7 provincial and 1 national park. The latter was highly significant because sandparks had initially been strongly opposed to the use of immunocontraception in elephants. Addo Park joined the program in 2013, two of the portions of Addo, which excluded main camp, but main camp is going to be added now this year. Okay, and that's the greater part of Addo. Then KZN parks, we have Tembe, Mkuzi, Itala, HIP, Isimangaliso and Isimangaliso Wetland Park. So today, as we sit here, or I stand, there are a total of approximately 1,000 elephant cows on treatment, and these cows we find in 34 different game reserves. The new challenges posed by larger populations, well, remember I talked about individually identified cows as opposed to...
Yeah, 2 minutes.
2 minutes?
2.5.
Oh. And they cannot be done on an individual identification basis. This is due to the numbers as well as the terrain. And to facilitate darting, matriarchs or other females are radio collared so that you can find each herd. Once you've found the herd and you know the numbers, then you can start your vaccination. Okay, this is, JJ will probably talk about this, but this is the use of mark and inject darts. So not only does it inject the vaccine, but it also marks the elephants and you know who's been done and who hasn't. So if we get to examples of larger populations where it's been successful, where we've proven it's been successful, most of the reserves have not reached 3 years yet, so we don't have that data. But we do have 3 examples where the results are available. And we've got Tembe Elephant Park, where it's been shown to be effective. The population has stabilized, and in fact, with the mortalities, it's actually decreasing. And we've got Addo Elephant Park, where it was successful. And we, in fact, in the 3rd year, had 0 calves born. And then we've got Itala, which is going to be presented by Pete Reinhardt, which has also got good news. Okay, I'm just going to flip through to the end. The other question is, do cows reverse when you stop vaccinating after a number of years? And the answer is, at least in the medium term, cows that have been vaccinated for 4 and 6 years reverse quite well. Okay, thank you.